Hi, welcome to the second video in the 3-minute massage. This video is on the kneading rotation technique. Now that we've warmed up the muscle tissue with the light stroking technique, we're going to get a little bit deeper, knead the muscle, much like kneading dough for bread, and increase circulation, stimulate relaxation, and get a little deeper into that muscle. So how we're going to practice that, first off, is when we're doing the kneading rotation, it's very important to keep that shoulder and elbow joint very loose, much like the light stroking technique. The best way that I know how to explain how to do that is take a ball, any ball, tennis ball, racket ball, whatever you've got, about yay big, and just place it on the table or the floor next to you. Rotate that ball around on your palm and just continually bring relaxation to the elbow and shoulder joint. Okay, switch hands. Again, while doing Japanese massage, you're going to want to switch your hands before one gets tired. So continually switch. That way, no one muscle comes to the edge of exhaustion. Okay? So once you've got that down, we're going to practice on ourselves. I find it's very important to practice massage on yourself because that's what gives you a little more insight or empathy as to what feels good on another person. So how we're going to work this, we're going to use the thumb pad of our hand. It's called the thenar pad. So we're going to place that pad right above the knee. Okay, we're going to be working the IT band. It's this wide, flat muscle that runs from the knee to the hip. So we're going to take that thenar pad, place it right above the knee, rest our fingers, and just bring rotation to it. Keeping that elbow, shoulder nice and loose. And we'll do 5 to 10 rotations in a spot, and then just slide down. So I'm going to rotate here, slide down about a hand width, and just keep the rotations going. Again, 5 to 10 rotations, slide down until you're at the hip or before your arm gets tired. Now, when one of those two things happen, you're going to hold your leg with the other hand, take your left hand, and begin working the inner thigh the same way. Again, keeping this elbow nice and relaxed, working the muscles on the inner thigh, sliding down again until you reach the uppermost portion or your arm gets tired, or before your arm gets tired. And then switch again, moving down, and switch again and move down. And I'd recommend practicing this as much as possible, and you can alternate. Practice on yourself, practice on your friends and loved ones. And now we're going to demonstrate how this is applicable on another person. So I'm going to bring my friend Andreas back again to demonstrate this. Okay, so now where we're going to be working is we're going to work in between the shoulder blades. It's called intrascapular. So if I'm looking midline on the spine and I find the edge of the scapula, that's the area that I want to be working in, just that small little area. And I'm going to work from the base of the neck to the bottom, to the very edge, very bottom angle of the scapula. So this area right here. How I'm going to get in that area, okay, on ourselves, on our legs, we're using the thenar pad. On this area right here, we're going to use, this is called the hypothenar pad. Okay, the opposite side, the pinky pad. And if you feel there's a little bone right here, if you want to, you can dig a little deeper later on. But we're just going to use this fleshy part right here. Okay, so how we're going to do this, if I'm working on the right side, I'm going to use my left hand. I'm going to use my right hand to brace because I'll be putting some amount of pressure on Andreas. So I'm going to brace here lightly. I'm not going to grab it, but I'm just going to brace flat fingers lightly here so that as I'm applying pressure, I can also hold him back a little bit. Okay? So, applying this, again, I'm just going to place my hypothenar pad in between his scapulas, place my right hand in front to brace, relax my fingers, and just get that elbow moving. Nice little rotations back and forth in between the spine and scapula. And now when doing this technique, as you can see, I'm actually moving myself down. Because if I start here and I move my arm down, now I'm actually decreasing my angle, so I'm having to apply more effort. But if I'm down here, I have more movement in my elbow. Now I'm going to move to the other side, other hand. So if you ever find your elbow locking up, like it's not able to move fluidly, you're probably at, just change up your angle a little bit. So I'm going to do 2 passes on each side. And then the second place that I'm going to do this particular technique is on the shoulders. Now, to do the shoulders, I'm going to start at the base of the neck and work my way out to this little bony section right here called the acromion. So right here from the base of the neck out to where you start to feel bone. So this tiny little fleshy part. I'm going to go back to using the thenar pad of my hand. So I'll start here, come above my client. If they're sitting in a chair and you're standing, you're at a perfect height. If they're on a table like this, then you'll come up onto the table. If they're sitting on the floor, you kneeling is a perfect height. So starting here with the thenar, and if you notice, I bring myself off to the side because right here my shoulder's locked up next to my body. So I bring myself out just slightly, giving a little more access and room to that elbow. When I reach the acromion, I'm going to switch. A few rotations down each shoulder. Okay, so rotations intrascapular, rotations on top of the shoulder, and that completes the second technique in the 3-minute massage. Thank you very much.